Okay, we're good. So, hello everybody, and I'm absolutely thrilled to have the gorgeous, vivacious Dr. Lisa Mosconi here with us, all the way from New York to Ireland, which is the simple joys of technology. So, Lisa, welcome, and thank you so much for taking the time out today to chat to us. So, I think we could probably talk to you for days, months, years, but we, as we were saying, we both talk fast, so we
Yes.
get a lot in 45 minutes. I guess one of the things that I'm very aware of, because I've been following your work for a number of years now, and I'm a huge fan. But for anybody listening who isn't aware of, your huge background in research and so forth, do you want to just maybe give them just, a quick background into yourself and the work that you're doing?
Sure. So I'm a brain scientist. I'm a neuroscientist. I have a dual PhD in neuroscience and nuclear medicine, which is code for brain imaging. So I'm from Florence in Italy, and I did my PhD at NYU, New York University, at the School of Medicine. And then I started my academic career there as an assistant professor in the Department of Psychiatry. And then I moved to Weill Cornell Medicine on the Upper East Side in New York City, where I'm currently serving as an associate professor of neuroscience, neurology, and radiology. So I'm really busy. I'm super happy. I love my job. Honestly, I love my job. And 2.5 years ago, I launched the Women's Brain Initiative at Weill Cornell, which is a research program entirely dedicated to women's brains and to really understanding how brain health plays out differently in women than in men. And we also really care about men, but there's so much research done on men historically, and there's so little done really for women. We know so little about women, and women's brain health remains one of the most overlooked, underdiagnosed, under-researched, undertreated fields of medicine. So that's really my passion. I've been really strongly focused and invested in women's brain health ever since I was 19. So it's a really long time. And I also wrote a book, which is The XX Brain, which is why we're here today.
This fabulous book, which we will talk in detail about in a few minutes. And I guess our I have a great passion for dementia, and I just want to show you my reason why, which is my lovely mom, who actually, Lisa, turns 90 today.
Happy birthday!
Yeah, but
it's wonderful.
It is wonderful. She has dementia, and it is quite progressive. So, that's obviously it's a cruel twist of fate, really, isn't it? That's why I so wish your book had been there for her. And I think, it's amazing the amount of women that I talk to who I've introduced to your first book, which was Brain Food, and then the XX Brain. And I know all of the message, so many people are just feeling blown away by the content of the book so far, which is it's just fantastic, because like you say, there's so much in that book that we haven't touched upon yet, the research that you're doing and so forth, and sorry, what I was, in terms of, we've shared, I've my mum, I know your grandmother, and I think some of your aunts had dementia as well, isn't that right?
Yes, my grandmother is really the reason that I started looking into women's brain health and whether it was different from men's brain health, because my grandmother was one of 4 siblings, 3 sisters and 1 brother, and all 3 sisters developed dementia and died of it, whereas the brother did not. He was spared, even though they all lived to the same age. And that was going on basically when I was in college, and I was already studying the brain, and I was looking at panic attacks and anxiety disorders using event-related potentials and this kind of machines. And my grandma really changed so much. And she was not mellow to start with, let me tell you. She was a feisty Italian lady. And she became very aggressive, which is something that can happen sometimes to Alzheimer's patients, even though it's more of a male behavioral change.
Okay.
Women tend to get more frustrated, more anxious, more depressed. She turned into Viking. I she's from the north, my grandma, and there was quite a thing. And she was very healthy otherwise, very physically, just strong physically. So she lived for so many years with dementia, and that was incredibly heartbreaking for us as a family, because we were taking care of her, mostly my mom. I take no credit, it was all my mom. And then I went to my mentor. I started doing this PhD, and I went to him and I said, am I doomed? Is my mom in trouble? What do we do? What do we know about Alzheimer's disease? Is it genetic? Because everybody says it's in your genes, right? It's a family history. So I'm not going to say it, I'm in trouble. And doesn't matter if the women in your family are affected or if it's a man in your family. And back then, he's amazing. He's absolutely amazing. And he said, sweetheart, the point is women live longer than men, and Alzheimer's disease is a disease of old age. So you guys don't stand a chance. Basically, that's what he was trying to say very sweetly. And I was like, oh, that's really bad news, And then it turns out that that's just really not true. I mean, back then, people didn't know better. And it took decades, because I've been doing this for 20 years, to really get to a point where we understand that it's so much more to women's brains than just the fact that we live longer than men. And this is really what prompted my whole research. I got so much pushback over these 20 years, and I had to deal with so much bias and so many stereotypes and myths and taboos and even sexism on many different levels. And so I really wanted to write this book so that all women would get a summary of my experience over time, and also really solid research around women's brains.
And I do one thing that struck me is when you read when you're reading through the book, and when you talk about bikini medicine, and you look at female Viagra, which was tested on 22 men and 2 women.
Yes,
I mean, I hadn't come across the concept of bikini medicine before.
Yes, it's a big part of my life, unfortunately. And it's really a funny term describing how historically medical professionals and scientists really believed that men and women were essentially the same person, except for our breasts and tubes. So these parts of the body that could be covered under a bikini. So taking that to a next level, it really meant that doctors would diagnose and treat both genders the same exact way, as long as we were not talking reproduction, which eventually led to women's health being a very restrictive field of medicine, right? Women's health is all about pap tests and measuring hormones and checking your breast for possible breast cancer, and the cervix for possible cervical cancer, and fertility. Our brains are just not part of the picture. Like never in medicine are you taught anything about women's brains, or in science, in neuroscience. Especially when we're talking about women's health, we're not talking about their brains. It's the last thing on their list. And so I think little by little, I got to really work at the intersection between neurology, neuroscience, and women's health. And we're really trying to bridge the gap and improve communication between brain people and OBGYNs and menopause specialists and women's health specialists. And it's been so incredibly rewarding.
And I think it's like it's great kind of to see, and I think it's going to be very exciting in the next few years in terms of the brain imaging, all the research that you're doing currently to really just kind of understand, I guess, the role of estrogen, on the brain.
Yeah.
And like, so, it's kind of moving us past the bikini medicine time, in
Love.
terms of, being able to actually concretely have studies there that are very much concentrating on women and in an effective way. Because, obviously, if we look at the big study, the Women's Health Initiative, which was obviously, kind of the cornerstone study that was done around HRT and so
Yeah.
forth. I mean, that's a big, I guess there was a
Bummer.
lot, yeah. Yeah. I guess that has that, as you say, like, a lot of the media jumped on certain aspects of those results that I guess, they liked, in terms of, look, there's always going to be scaremongering and so forth, in terms of jumping on the cancer trials and so forth. But I think, for women to understand the studies that do come out is so important. Because, I mean, we've seen that when it comes to, HRT, in terms of the audience that we're talking to, is crucial. And it's like, the amazing thing, Lisa, about your book is that, to me, it's like a signpost, and you say it so eloquently in the book, in terms of, it's trying to help women when you've all this information coming at you when you're in menopause. It's extremely, you're trying to navigate what can be murky waters, and the practical tools that are there, I certainly think are fantastic, to kind of send you in a direction. But can we talk a little bit about estrogen and the brain? Because,
Of course.
I guess that's what it's all about.
Yeah, it's a
A lot
big
of,
part of the research that we're doing, and I think also findings that are very new really focus on the effects of estrogen activity in the brain. And I think that it seems to not be clear at all to most people that our sex hormones are not just involved in reproduction. They're also involved in brain function. And actually, what was really fascinating to me to learn is that this is not common knowledge at all.
yeah.
Yeah, for me as a scientist, it's obvious, but I then realized that scientists have done a fairly poor job of really communicating this to the world, right?
Yeah.
Because so many women are really confused when they go
Yeah.
through menopause, and they're like, what is going on? Actually, even before menopause, during perimenopause, which can be many years. I mean, we're
Years
talking
before, yeah.
years, right? Very, here, yeah, the average is 4, but the range is 2 to 8.
Yeah.
I mean, there are some, sure, outliers of few women, but they get perimenopause for 8 years. That's a
Yeah.
lot of time.
8 to 12.
It's incredible.
Yeah.
And all these symptoms that women are aware of and everybody heard of, like hot flashes, night sweats, insomnia, depression, anxiety, the brain fog, even the memory lapses, right? We tend to associate all these symptoms with the ovaries. And that makes sense because as a woman that there's something changing in your ovaries, you're skipping your period, and you get the symptoms. But those symptoms do not start in the ovaries. They start in the brain. Those are neurological symptoms. We're just not used to thinking about them as such. And the reason that we get the symptoms is that our estrogens are not just present in the ovaries and the rest of the body, but also in the brain. And their behavior in the brain is different from their behavior in the rest of the body. Is much less predictable. Not that, the periphery is much easier to predict, but in the brain, we just really don't know what's happening because we can't see it.
Yeah.
You can't measure estrogens in a woman's brain. So what happens is that your estrogen levels are swinging. They're high, they're low, they're too low, they're too high, they're all over the place. And what estrogen does in the brain is really activate energy metabolism. So estrogen in the brain acts as an energizing hormone, among many other things, and it literally pushes your neurons to work harder and burn more sugar, more glucose to make energy. And estrogen is like turning on a switch, and you keep the switch pressed on as long as estrogen is inside your brain. If you keep going back and forth, when a kid keeps pushing on a switch, right, on and off, on and off, on and off, the same thing happens inside your brain. But the problem is that the regions that are impacted by this are the brain regions that regulate body temperature, for example, like the hypothalamus, right? So if estrogen is not regulating, it's not activating the hypothalamus correctly, your brain cannot regulate your body temperature correctly. And then you get the hot flashes. The same for sleep. Estrogen regulates the brainstem, which is the brain structure in charge of sleep and wake. And when estrogen is not doing it right, then you can't sleep at night. You have insomnia. You have the two things together, obviously, you get the night sweats. And then there's the depression and the brain fog that starts in the hippocampus, but also the frontal cortex. So basically, estrogen is not just involved in having kids or not having kids, but also we refer to estrogens, plural, all female hormones, as the master regulators of the female brain, because they energize your brain, they keep it active, but they're also involved in immune system. They really boost immune function, in plasticity, in growth of new brain cells, and a number of other functionalities. They're really plastic. They're growth hormones. So if you don't have them when you go through menopause, the same way that your skin gets a little drier, your hair gets a little drier, the same thing happens in a way inside your brain. Your cells just start aging a little bit faster.
Yeah.
And that could lead to a number of things, including Alzheimer's disease for some women.
Yeah, and I guess it's interesting there where, if you look at, there was a study done, I think it was in the UK a couple of years ago, where they looked at women who were experiencing hot flushes and night sweats, and they introduced some form of daily meditation or mindfulness, and they found there was a 60% reduction in hot flushes, because obviously the mindfulness meditation is so good to calm your brain. So it's that connection, the physical connection with the brain, and the hot flushes and so forth.
Right. And also one thing that people are starting to show more and more so is that stress can really make the hot flashes worse.
Yeah.
Because stress increases cortisol levels.
Yeah.
And cortisol is the main stress hormone, and it works in balance with your estrogens. So if your cortisol goes up, your estrogens go down, and you get even more swings and highs and lows. But if you reduce stress, your cortisol levels go down, and your body can start producing estrogens again. So stress reduction is a very gentle form of hormonal replacement therapy, if you will, or hormonal stabilizing therapy, which I think is so important to know, because stress is bad for you regardless of where you are on the menopause spectrum. It's bad news for your body and your brain. So it's really a win-win situation. You have to reduce stress. And right now, everybody is under stress. And I think it's just so important to believe that stress reduction techniques actually work.
I mean,
many people are like, yeah, sure.
Oh, they do work though. I think once you try them, I think once you try them, you'll know that they work. I mean, I'm always a different person after 12 minutes of meditation. It kind of just turns your day around, I think. And it's interesting, when we talk about kind of, stress and so forth. There's a campaign that was launched here in Ireland this week by the National Women's Council of Ireland, and it's basically looking at supporting women's mental health, given obviously with COVID, there's more pressures, and like you talk about in the book, the caregiver burden in a lot of cases falls to us women. And particularly when you look at Alzheimer's and dementia, generally the majority, not in all cases, but the majority of the time, the primary carer, can certainly be a daughter, a daughter-in-law, etc. And I think that caregiver burden, can be kids, etc. It's massive. It's massive. And I was thrilled. I was thrilled to see it raised in the book, because every time I talk to women over here, we underestimate, we put ourselves, as in we put everyone before us.
Yes.
And I think taking the time to actually stop and realize that, I think our duty of care is firstly to ourselves, to look after our own health, because down the line, say, if we don't look after our health and we do get a neurological condition, it's our family who's going to have to end up looking after us.
Yes. Yes, I totally agree. I also really believe in balance and asking, like, you can't pour from an empty cup.
Yeah.
You need to be allowed to really just feel like a normal person. I had some moments of total burnout when my daughter was born. My husband was still working at MIT in Boston, so he was not with me for 2 years after she was born.
Okay.
Yeah.
Okay.
And I was working full time with an infant who just would not sleep at night. And that was my first time experiencing caregiver burden, and it's incredible. I can't even imagine, because then he moved back and she started sleeping. But once you're caring for someone who's actually sick, who has an illness, it's just mind-blowing. I'm so incredibly just humbled by all the caregiving stories that I get to hear every day, and how people are trying to cope with this unbelievable situation where, on top of caregiving, you also have lockdown and you don't want to expose your parents to possible germs. It's just incredible. But I think it's very important to acknowledge that self-care is needed, and it's really important to work with the family to just allow whoever is taking care of somebody else to really have a little bit of time to just recover from that and replenish. And meditation can be very helpful. Yoga, I find, for me, yoga,
I love yoga.
Right. I mean, for me, it's the only thing that really puts me back into
it grounds you. I think
exercise as well. But yoga is different, because you get to breathe.
And I think, exercise kind of, it's a no-brainer, isn't it? It just
but you need to have the time. That's the problem with exercise. Like, I used to run, and that's it. I turned into a mom, and that was the end of my running days. I just can't make the time. So I think it's really important to be creative in general, and not follow trends, but just find a solution that works for you, that is not just enjoyable but also sustainable. And something that you can do over time, with whatever time you have and whatever space you are. And instead of being worried or sad that you can't do high intensity interval training, for example, just do something gentle. Just do it at home. Go for a long walk, which is actually also good for a lot of other reasons. Just be nice to yourself and kind, especially now.
It's something you enjoy, isn't it? It's something you enjoy. And just, in relation to, and I'm just going to show, I'd like to show this for anyone who, so in Lisa's book, you work through a whole series of tables in terms of different healths, your heart health and etc. And I don't know about everybody else, but we all like tick box. But I think just in terms of the following the direction and so forth, and around the I think we refer to it here very much so as HRT. I think you call it MHRT in the States. Isn't that right? But when you looked at that, is it where would you say the kind of the end line is in terms of if you have someone who's in menopause and not many symptoms, but yet is kind of thinking, okay, how do I protect my cognitive health down the line? Is it a matter that they should look at and consider HRT, or what are your thoughts on that? I know it's a big question.
It's a big question. I have a lot of thoughts, and learned recently that the recommendations are very different in the United States and in the UK. I find that in the UK, there's a lot more, I think maybe medical specialists are more comfortable around hormonal therapy, and they're much more inclined towards prescribing it. Whereas I find that in the United States, we're much more conservative, like much more. And I'm not an endocrinologist, I'm not an OBGYN, I'm a brain person.
Yeah.
Right? So for me as a scientist, I would love to see more clinical trials of hormonal therapy of HRT for brain health, because right now we just don't have the data to even have an opinion. Honestly, I can tell you what not to do. Like the Women's Health Initiative that you mentioned, they actually looked at HRT as a possible preventative against dementia. And what they found is that if you start hormonal replacement therapy, although they were using very high doses of oral estrogens, right? So 10 years of work to find out that if you're taking oral estrogens of very high doses or an estrogen and a progestin, starting more than 6 years after menopause, that doesn't help at all, and actually can make it worse. Okay, this is only oral estrogen. Nobody looked at transdermal.
Yeah.
If you are within, this is not the Women's Health Initiative anymore. This is the KEEP study and the other huge clinical trial that just ended. If you are within 6 years of menopause, regardless of what kind of HRT you're taking, it doesn't hurt your brain, but it doesn't help your cognitive performance either, at least in that clinical trial that lasted maybe 3 years.
Okay.
Right. So is that definitive evidence that HRT doesn't work? No, because so many women take it and their memory snaps back into action. They feel so much better. They can perform so much better. I have so many of our participants who are like, you're not taking my estrogens away from me. You're just not doing it.
Yeah.
So I think we really need to better understand what the window of opportunity is for estrogen therapy, right? So I think what we are missing is information about women's brains, because ultimately we are trying to impact estrogen levels in the brain by giving HRT to women, right? All these hot flashes they want to get rid of, they start in the brain. The depression comes from the brain. The insomnia comes from the brain. The memory fog. We need to see, if I give you HRT, what happens in your brain. And I can't do it because I don't have the technique. We can measure hormones in blood, but there is no correlation between hormones in blood and hormones in brain. So these clinical trials are in a bind, if you will, because it may be fantastic. We just can't stratify women between those who need HRT and those who no longer need it or no longer benefit from it. So long story short, we just developed a tool that allows us to track estrogen activity in the brain. This is for the first time. It was just FDA approved during lockdown. So as soon as we can start research again, we'll start a clinical trial to really better understand when to treat, how to treat, and how long to do it for. And then I can answer better your question. Right now, I would say it's very personal. For some women, HRT is a godsend. For some women, it's intolerable. You know, some women swear by it. Some women swear at it. So I think it's really important to find a good doctor, a great menopause specialist and coach to really help you make the right decision for yourself. And possibly work with somebody like me who can also really probe your brain and cognitive performance to make right decisions, not just for the hot flashes and maybe osteoporosis and whether or not you had a hysterectomy. In that case, you do need the HRT right away. So there are so many different scenarios. And again, I was talking to Louise Newson. And she was like, HRT 100%. And I was like, well, in your hands, why not? But a lot of menopause specialists here in the US are not as comfortable with HRT, and it depends on what kind of doctor you have.
Yeah, and I guess the other thing is that there's so many different forms of HRT, and
Okay.
transdermal through gels, patches, and so forth doesn't have the same it doesn't have the same impact as an oral systemic tablet. So it's a whole different realm, when you get
Right, and so, and like Louise was saying, well, transdermal is a godsend. Most women can tolerate it.
yeah,
And I was like, yeah, absolutely great, but we need to test it for brain health.
yes, yeah, yeah,
So let's do it. I would
yeah,
say let's do it. This is when women should come together
yeah, big
and
time.
say we need this data. We need actual data
Yeah,
to
yeah,
really inform medical decisions for the best. And it takes two things. It takes scientists who want to do it, because a lot of people don't. It
okay,
takes women who want to be part of in the research, who
yeah.
want to, who then allow the scientists to actually do the research. And then we need sponsoring agencies to be interested in women's health and women's brain health. So actually needs three things.
And Lisa, is that something you think we'll be able to get involved in Europe, or is it going to be just it'll be local to the US?
Oh, I'm hoping global for
Oh,
sure.
great.
I
Okay,
mean,
God,
I'm hoping, I don't know.
uh,
I think
that
there are
would
more
be,
and more people who are interested, and I'm sure
yeah,
in England, I mean, in
in
the UK,
Ireland.
right?
Yeah, yeah. Well,
There's a lot of requests, right? And
yeah,
obviously, if you want to come and join us, great. But there's an ocean in between, and if there's
yeah,
a way to collaborate with other
yeah.
doctors
I,
and scientists in the UK, I'm all for it.
Yeah, yeah. I think certainly, I think from our perspective in Ireland, I mean, we're talking so much more about menopause now than we ever
Yes.
did before. So I think anything, that we could get involved in, I think would be really, really welcomed. And I think particularly too, when you look at, I think the statistic you mentioned, of Alzheimer's patients, 2 out of every 3 are women.
Yeah.
So I guess it's a stark statistic, and it's really to our advantage that we can, try and help each other in terms of understanding why,
Hmm.
um,
Yeah.
just one, just moving on. I'm just kind of conscious of time, and there's so much to talk about.
And
But in your book, there's great talk about you cover HRT in great depth, and you also cover the alternatives in terms of lifestyle and diet and so forth. One of the things, if we can just talk about it for a minute, because it's a real passion of mine. I see it nearly every day. Women, people, men, people in general do not drink enough water. Just don't.
ah.
Just don't. And it's
Look, I have my water bottle right here.
yes, and I have my glass here.
Well,
But
that's a little one. You need a
yes,
big
yes.
bottle. I drink at least 3 or 4 of these every day. This is
Wow. Okay, that's probably about a
27
liter. Is
ounces.
that about a liter in that?
No, it's more. This is two
Wow.
liters for
Okay.
sure. At least
Okay.
two.
Okay.
Yes, 27 fluid ounces, which I have no idea what it means in
So, so
in
I know.
milliliters.
Yeah, it's a good amount. So I know that you share that those thoughts on water. So can we
Yes.
just talk about that a bit in terms of, I know 2% dehydration will impact
Hmm.
your brain
Yeah.
memory, right?
Yeah. So the brain is the one organ in the body that is really immediately impacted by dehydration. And that's because the brain contains the most water of all organs. So it's over 80% water, whereas the rest of the body more like around 60%, depending on the organs, of course. But that also means that the brain is super sensitive to dehydration, so much so that even a minimal water loss of 2%, 2 to 4%, can really provoke neurological symptoms like dizziness, brain fog, not to be confused with the menopause brain fog, but perhaps they interact to make it worse. But also vertigo is a very common problem, and also really memory decline, not in a progressive way, but just you can't remember things.
Yeah. Yeah.
And that's so easily reversed by just drinking water. And I was shocked when I moved to the United States that no one drinks water. And the only people who drink it drink purified, I mean, not the only people, but the majority of people who drink water, drink purified water that is also so cold.
Yes.
It could be winter, summer, cold. It's coming out of the fridge. And what I always try to say is that, okay, purified water. Do you drink do you have a lot of purified water over there?
We'd have a lot of I guess like home filters and filters in work and so forth. So what you wouldn't probably have as much here is, I don't think we'd be as heavy on cold water as in America. I remember when I worked in New York, oh man, it'd be literally like, may as well just be ice cubes because it'd be so cold.
Yeah. So the thing about purified water is that it is fluids, right? It provides you with fluid, so it gives you pressure in a way. It helps with your blood pressure, but it does not contain the electrolytes that are needed for hydration. Right? So there's the volume of the fluid, but not the hydration, not the hydrative elements, like all the salts and minerals the water is made of, really, besides the fluid. And those are the nutrients that you need to be hydrated. And then the other thing, so tap water is better. And most home filters are not purification systems. So they remove the impurities, they might get rid of some of the minerals and salts, but usually they don't really purify the water. So they're broadly fine, I would say. But purified water, distilled water, soda, seltzer, that's just not water. It's a liquid, it's a beverage, but your brain doesn't just need something wet. It needs something that is actually hydrating. So it's important to be mindful of that, because dehydration is an incredibly common problem for so many people. The other thing about cold or room temperature water is that cold water is vasoconstricting, whereas warm water is vasodilating. And you want your veins to be dilated in order to be able to absorb the nutrients more easily. So whenever we do a brain scan, because it involves an IV, right, or at least, whenever you go for a blood draw, what you really want to do is to drink at least 1 or 2 glasses of warm water, or hot water even better, 20 minutes prior to the procedure, to have so that your veins really pop.
All right.
And then it's so much easier for us to put the line in and do whatever we need to do.
Okay.
So I would recommend that if you feel dehydrated, not in the summertime, of course, now it's like 95 degrees, but usually in the morning, the first thing I do is to drink a glass of warm water.
Yeah.
When people say, I always drink warm water with lemon juice. Right, and they're like, it's a trend, it's a fad. It actually makes sense. That's one thing that makes sense, because you're rehydrating, right? You're rehydrating, and then citric acid in lemon.
The peptin from the lemon.
Right. Well, I was thinking the citric acid is actually a natural laxative, so it really kickstarts digestion. It's true. That it works out. So it's a good habit to have if you like lemon juice.
I that's my go-to every morning. Sorry, there's a question there for someone who's going through menopause, no symptoms, but fearing dementia.
Oh, that's good. Well, no symptoms is great. So no symptoms during menopause is only 20% of women. So sorry, did I just cut you off? So rude, I got excited. Well, the good thing is, so if you don't have symptoms, it really means your brain is compensating very easily for the changes in estrogen declines. And what we're trying to do now is to really look at different patterns of symptoms in menopause. And there's 20% or say 15% of women do not have any symptoms of menopause. And those women are the least likely to show energy brain changes on a brain scan.
Okay.
Or the Alzheimer's plaques. So we're looking into that more. But then there's 80% of women have hot flashes. And within the 80%, another 50% of the 80% of women also have other symptoms like mood swings and brain fog. So we're breaking that down into smaller and smaller groups, women with all the symptoms and women with just a couple of symptoms. And we're trying to look at different patterns. Like, what does your brain like if you
Yeah.
have no symptoms? What does it look like if you only in quotes, have hot flashes? What does
Yeah.
it look like if you have hot flashes and mood swings? What does it look? So we're really trying to look at patterns, not just cluster symptoms, but also brain patterns associated with the symptoms, and then correlate that with risk of Alzheimer's.
That would be, I mean, that would be just phenomenal research.
Yeah.
So say for that woman, her question is, what should she be doing to protect herself against dementia and Alzheimer's?
If you have no symptoms of menopause.
Yeah.
I think you're in good shape. Well, as far as the menopause is concerned, but I think all the other recommendations included in the book are really helpful for brain health overall and Alzheimer's prevention. And they include a number of things from mental stimulation, learning, which is really something I like to say is that learning is to your brain what exercise is for your muscles.
Okay, yeah.
You really have to learn something new to have the synapses fire, your neurons fire. It's creativity that is so important, and the learning and really having your brain challenged is really important. Exercise, talking about that before for menopause, but exercise is really good for brain health and Alzheimer's risk reduction as well. Diet, I love diet and nutrition, and it's so important to eat healthily because most people eat at least 3 times a day. Right? So every day you have 3 choices and 3 chances to really support the health of your brain and body or sabotage it. And it's really up to you. Changing your diet is totally doable. It takes discipline, and sometimes it's maybe a little daunting, but the benefits are for life. And it's not just for you, it's also for the entire family, right? If you can support each other, eating more healthily and making the right choices is even fun. So my daughter, who's 5, just turned 5, she loves healthy food. You would not believe how she just goes off on a tangent, like, that's really bad food for you. You should have coconut sugar instead of that thing on top. And where are my goji berries? And mommy, where are my greens? And, she also likes the other food that she understands. Certain foods are healthier than others.
I've seen her drinking green juices and so forth on Instagram.
Oh my God. Yeah. Every morning, because I have a smoothie for breakfast now. And I'll have spinach and kale and mango and frozen blueberries and almond milk and flax seeds and whatnot. And I always share with her. So she starts the day with a huge smoothie and she loves it. We'll do almond butter in the smoothie. And so it's super good. Yeah. She loves it. She'll drink a big thing of that. She has a salad for breakfast. And then she'll have a ton of other things. Right? She likes her toast, or she likes her oatmeal, but she always we're always starting the day with veggies and fruit, which I think is really helpful.
Oh, I think
coconut. She loves coconut.
The cornerstone of health is food. It's I think it's a given, and obviously you covered in great detail in the book the different food groups, the omegas and etc. that are good to include. But so I think that kind of covers that one. There's another question here. Why do some people suffer from severe headaches? What's the connection with the brain?
That's me. That's me too. I get headaches and migraines all the time. For some women, it's really hormonal. There are so many women whose migraines or headaches are due to hormones, and in that case, it would be really good to talk to a specialist. Most people go to see neurologists for headaches and migraines. Like, neurologists are considered the best in that space, but it's not necessarily the case. For me, I get tension headaches and migraines is really related to the fact that I'm constantly in front of a screen and whatnot. And most muscular. So the brain cannot feel pain. So whenever you have a headache or a migraine, it's not your brain that is suffering, it's the muscles in your scalp and neck and shoulders. Most of the time. If you're having hormonal headaches, it's a whole different physiology that needs to be addressed by talking about hormones. Sometimes a lot of people get headaches because they're dehydrated, for example, because of a vitamin deficiency in minerals, vitamins and minerals, like you're low in electrolytes, for example, or magnesium is too low. Your diet is not rich in veggies and fruit, for example.
Yeah.
So there are many different things that can happen. And then, of course, there are genetic migraines, and you have to go to a neurologist for relief, and medications is the only thing that helps. But sometimes acupuncture can help. Getting a good massage can help. Yoga helps me enormously. I would strongly recommend try candle pose, legs up against the wall.
Oh yeah, that's a great
one. The bends, right?
Yeah.
Really just
blood flow. Just I do that in the afternoon sometimes. You know, if you get the 3 p.m. slump, you know, I'd find it great just kind of putting my legs up against the wall, and it just
right.
Sets
if you can do a headstand, you try a nice little headstand without hurting yourself. But anything that involves providing relief to your neck and head, right? You just want it to be upside down instead of at least for a little bit. Even just one thing my mom would do, and she's been doing yoga for so long, she's incredible, so flexible. She would lie down, she gets headaches, and they start in the neck. She has cervical pain. So she would lie down on the bed, on her back, and then just let her head hang down.
Over the side of the bed. Okay.
Yes, and shoulders and neck, and that helps.
Okay, that's a nice little tip.
Yeah, try everything behavioral before taking medications if possible. But
no, I think that's we'd share that view. There's just another question here. How does the brain work when it comes to depression? How do you motivate your brain when you feel so low? That's a big one. I probably would say Lisa's first book, Brain Food, is probably a very good place to start in terms of you know, motivating your brain and depression. But Lisa, you'd have some ideas on that.
I think also in the XX Brain I talk about depression because it's such a common symptom for women, and my recommendation is to really try and understand what the root cause of the depression is, because there are many different forms of depression and we just don't talk about it as much. For some women, it's hormones that are changing. For some women, it's genetic. For some women, it's other things. It depends. Is it situational? Did something happen to you? Is it COVID that is really creating a lot of anxiety? And then you perceive as depression, but there's a strong anxiety component. So I think it's important to try and understand why you're feeling depressed. Like, I'm just gonna share this. This is funny. When first we got in lockdown for COVID, it was really bad here. It was really, really bad. It was very stressful and difficult. And one day I said to my husband, I said, I just feel depressed. I'm just not feeling good. Like, it's not me. I'm usually very like, all right, we'll just make it work. We'll find a solution. And I did something. This is not a treatment for depression. It's just if you're feeling a little bit down in the dumps, you know, for situational reasons. But I made this thing, which is amazing. It's like 85% dark chocolate melted together with coconut oil and raw cacao powder and some maple syrup or honey, and also hazelnuts, because I love hazelnuts.
Oh yeah.
You mix it all together, put it in a container and freeze it. And then you literally break these pieces of ganache. It's effectively dark chocolate ganache. It's incredible. It just put me back. I was back within one day. I ate a ton of chocolate, but 85%, 90% dark.
Yeah.
Because it's rich in tryptophan, which is the amino acid that your brain needs to make serotonin. And if you combine that with a simple sugar like honey and maple syrup, it gets inside your brain even faster, especially if it's mixed with some fat. So usually, you know, the original recipe is with butter. I would not necessarily recommend it. So I swapped with coconut oil. And this whole combination is really incredible. I recommended it to a lot of my friends who were also feeling really overwhelmed and really just like, oh my God. Yeah. And everybody said, this is incredible. I'm eating the whole thing. And so I don't know if you want to try, but it's not for serious, you know, it's not for severe.
Yeah, no, I know.
It's just for a difficult moment.
Is that on your website, Lisa?
No,
No,
I should
okay.
put it up there. Is it? I'll send you
Yeah,
the
send
website.
me a link and I'll
Yeah.
share it, because I think people would love that. I'm definitely on for that one.
I
uh,
think I posted it because
I
somebody
think I saw
mentioned.
it on Instagram at some point, but might have been
Yeah.
just a picture of it. I'm not sure. Um, I just want we'll
No,
take.
I need to put it up on my. I'll do it.
There's okay. I'm just going to take one last question, because then I do want to ask you for kind of some your top tips. Um, when is it considered too late for? We might have addressed this. When is it considered too late for HRT? I'm nearly 8 years in menopause after radiotherapy for cervical cancer. I was given little to no support and didn't know HRT was an option. Now I've osteopenia and find I'm forgetting things along with feeling flat.
It really, you need to ask a doctor who knows you and your
Yeah.
medical history. I think it would really be doing you a disservice to suggest anything.
If that's someone based here in Ireland, I would probably recommend that you'd consult with an experienced menopause GP, and if you need some names, just send me a private message based on where you are. I have a list of resources of good GPs, so I could certainly help you on that one. So Lisa, I'm just conscious, sorry, of our time. So there's so much to cover, and honestly, can I just say to anyone who's listening, and I know people, I talk to a lot of women about this. Laura's book is a must, and not probably just for women. I think probably for men too, in terms of understanding women, and maybe understanding what can happen. But there's so much covered in the book. It's a bit like, to me, it's like a friendly guide of, listen, read this and you're not going to go wrong. But just on that, what are the top tips that you would give to someone who really is just conscious of? There's a lot of us, obviously there's a lot of dementia, Alzheimer's in Ireland. There's a lot of us who are kind of aware that one of our parents may have had dementia, Alzheimer's, and whilst we know that genetic link isn't enough to say it means you're going to definitively have it. That's not the case. But
Right.
what would you say to us? What's your nuggets of advice?
Well, I think I have two. I think my number one piece of advice is to really identify your own risks, which is what I was trying to do. But I hope that I accomplished as well.
You did.
In part 2 of the book, where you take all these questionnaires, and then in the end, there's a summary table that really helps you visualize what your greatest risks are.
Mm-hmm.
And then you do everything you can to minimize, reduce, or completely eliminate those risks. Right. So you want to prioritize, not based on what I think is important, but based on what is really important for you.
Yeah.
So if anybody's interested in taking the questionnaires, do that. And then you get, you'll see visually in the table, you really need to address this, and that.
Yeah.
This is what you prioritize, because I can tell you change your diet, but maybe you don't need to. Maybe what you need is to sleep. Maybe what you need is to reduce stress. Maybe what you need is to avoid toxins. Toxin exposure is a big risk factor for Alzheimer's that we don't talk about enough, but it's also, regardless of Alzheimer's, it's something that really negatively impacts brain health. So that's another thing that one can. And then the second thing is listen to science. Do not buy any more supplements. Do not just go for medications if you can manage your symptoms without.
Yeah.
Right? Just put a little bit of effort, change your behavior, change your lifestyle first.
Yeah.
Because for so many people, that's enough.
Yeah.
That's enough. And you get the benefits immediately, and it's just for life. It's you're in control of your own health, which is a very empowering experience. And you can give so much more to yourself and to others once you're really the best version of yourself that you can possibly be.
Yeah.
Right? Not depending on somebody else and constant medical bills. I think if you can make it through lifestyle changes and by working really closely with your doctor to manage any medical conditions that could potentially increase risk of Alzheimer's and dementia, I think that's absolutely fantastic. And look, it's not going to happen in 2 weeks. I know there are so many books out there that are like, oh my goodness, completely reverse your risk of Alzheimer's in 21 days,
Yeah.
14 days to weight loss, and whatnot.
Don't buy those books, please.
Don't buy this way. That's just like, oh, please, another one. They're just trying to sell money, they're just trying to make money out of you. But what you want is solid, rigorous science.
Yeah.
So you can count upon, that does not change with the season, that does not depend on marketing, right? You want strategies that are time tested, that have been working for many other women, and that are proven to actually be beneficial.
Yeah.
Right? So,
and I just want to show people. So this was my table there. So you can see, and so I have to identify my risk. So I know my risk is, well, menopause is pretty, actually not too much of a risk. I probably was trying to go a bit hard on myself for that one. But I would know stress is the one thing, particularly now at the moment with homeschooling and so forth. So I think that's fantastic advice, because, as you say, it's personal to all of us, isn't it?
It's personal, yeah. There's no such thing as a one size fits all strategy or recommendation. It really, I mean, there are general recommendations that are just common sense, honestly, and just work for everyone. But then I think it's so important to really take a minute to really focus on ourselves and things that we need and we want, and what are your goals, what are you trying to achieve, and what are your risks and vulnerabilities, and what are your strengths, and then try to come up with a plan that really works for you as a person.
Very good. It's fantastic. So I think Lisa, I know you've got another meeting now, so thank you so much. Thank you so much.
Oh my goodness, my pleasure. It was so good to see you.
Absolute pleasure. And I'm looking forward to when we have you here.
Yes, me too. I loved Ireland. I went twice. I was there twice when I was little. And it was incredible. It's like a fairy tale. I just can't wait to bring my daughter in.
Yeah, it is lovely. And it is. It's a lovely spot. We're blessed, really, and particularly we've been able to enjoy it. Well, not everybody, but for some of us. I live very close to the mountains. I'm close to the sea as well.
Wow.
The last few months, it is great in terms of you're out more, because with COVID and so forth. So if there's any of the questions, we didn't get through all of them. So certainly, if people want to message me or email me afterwards, I'm happy to go back on some of the questions. But certainly, if you're to order one thing, that's what you need to order. So Lisa, thank you so much, and we'll chat to you soon. Thanks everyone for watching.
Thank you so much, everyone.
Bye.
Ciao. Bye.